Firstly, can I say that all week we've been pleading to the people of New South Wales to come out and get tested, and incrementally we have seen since Sunday, each and every day, an increase to those testing numbers, and I'm very pleased to see that. I want to say thank you to the people of New South Wales. As I've always said consistently over the course of this week, the secret to beating COVID is actually the data that we can collect, and the more that we test, the more confident we can be in making decisions as a government, and we are ready and able. Clinics everywhere. Like yesterday when we announced that an 18-year-old male from Sydney had travelled out to the Central West, places like Orange, Nyngan and Broken Hill, within hours. We had drive-through clinics set up, another clinic set up, and we're committed to making sure that we put in place the resources, regardless where you are in New South Wales, to get tested. And on that, you know, when you think about on Sunday when I first started, the test numbers were about 18,000, and then it became 22,000, 26,000. I was aiming for a $30,000 mark, and Minister Hazzard, Dr. Kerry Chant, we've been pleading, and I can say as of 8 p.m. last night, there were 32,667 tests. So thank you to New South Wales for coming out. My challenge, but is that we continue to come out and get tested. If we can remain in the 30 to 40,000 range, that would be fantastic. Again, if you have a symptom, if you're not feeling well, you've been tested prior but not sure, please come out and be tested. And Minister Hazzard will have more to say about testing. Out of the 32,667 people last night, we had 5 new cases in New South Wales. One was an overseas case, 2 related to the Barilaro cluster, and 1 to a household contact in Avalon. Now, to the people on the peninsula, and especially the northern zone of the northern beaches, I know you've been doing it tough. You've been locked down for a period of time, but that was off the back of a significant seeding event and the transmission of COVID in that area. We make these decisions to protect everybody, you, your family, the state and the nation. And I know how hard it's been. And I know in conversations with, of course, Rob Stokes, the representation that Rob's doing on behalf of the beaches, especially on behalf of businesses that are really hurting, can I say, firstly, thank you for the effort and understanding that, you know, if we're going to beat this, we really do need to eliminate the pandemic in a way. But the only way we have confidence in our decision-making is through that data. And as you can see overnight, we have had a household contact of someone in Avalon and connected to the Avalon cluster. And that is why we will continue to keep the restrictions in place as we've previously flagged up to the 9th of January. And as much I understand it hurts, and I know for tomorrow, for instance, it's Orthodox Christmas. I know the cathedral, St. Sabbath's down on the peninsula will be closed. I know the impact that has on families, on people at an important time of the year. But it is our point that we're doing this to protect everyone long term, and that is why we'll continue with those restrictions in place. The 18-year-old man yesterday that travelled from Sydney and Barilaro out to the regions, of course, was tested, and again, an example of the sort of people that respond to the text messaging from health, that have responded to government in getting tested. He was on that trip with a number of mates. Those mates were tested, and those results have come back negative so far. And again, my plea to the people of Western New South Wales, in Nyngan and Orange and Broken Hill, if you're not feeling well, please come out and get tested. And that is very, very important. As I said earlier, we've got a case connected to the Avalon cluster, 2 to Barilaro, and there's 1 still under investigation. I will get, of course, Dr. Kerry Chant to detail further in relation to that. I know also in relation to cricket and what has just been announced in Victoria around a patron or a spectator at the MCG who is now tested positive, and I'll ask Minister Hazzard to say even more about that. And then, of course, I have Howard Collins from Transport New South Wales to talk about the arrangements that we will have in place in relation to getting people to and from the test in a safe way. So with that, I'll ask Dr. Kerry Chant.
So New South Wales recorded 4 new locally acquired cases of COVID in the 24 hours to 8 p.m. last night. One of these cases was reported yesterday but is included in today's numbers. There was also 1 new case acquired overseas, and that brings the total to 4,789 cases. As the Deputy Premier indicated, it was pleasing to see 32,667 tests performed in that 24-hour period to 8 p.m. last night, and that's up on the previous day's testing of around 26,000. It is critical that we see that sustained high testing rates. We do need that over a sustained period of time because we are concerned that there are unrecognised chains of transmission, particularly in the Baralla and the surrounding suburbs, including Wentworthville. We have established 2 additional testing clinics in Western Sydney, 1 in Baralla and 1 in Lidcombe. There's a walk-in clinic that's been established outside the Baralla Public School Hall at 216 Harrow Road and is open from 8 a.m. to 8 p.m. 7 days a week. And people attending the clinic will not be able to access to other areas of the school grounds and its facilities, such as any areas there. And there's also a new drive-through clinic that's operating in Lidcombe from 9 a.m. to 5 p.m. today, and then from 8 a.m. to 5 p.m. 7 days a week after that. And the drive-through clinic is located at the Sydney University's Cumberland campus, 39 Waroona Road, Lidcombe, with access via Gate 3. So just remember that testing is free for all and you don't need your Medicare card to be tested. Please come forward and get tested. So of today's 4 locally acquired cases, 1 is linked to the Baralla cluster, and this is the young man from Western Sydney I mentioned yesterday who also travelled to Western New South Wales, and there are now 16 cases associated with the Baralla cluster. So there was testing of his travel companions of the case, first announced yesterday, who had visited those towns in Western New South Wales. All have tested negative to date, but remember, they are in isolation for the 14 days since their last contact with the gentleman, and then they will be retested again on exit and if they develop any symptoms. The next case was a man in his 20s who's a household contact of a case linked to the Avalon cluster, and this is a household contact that has been in isolation for the full infectious period, and this is what we want to see and the whole purpose of identifying cases and enabling that public health action. And one was from Western Sydney as a household contact of a previously reported case whose source remains under investigation. And yesterday we said this case was likely to be linked to the Baralla cluster, but again that person was also isolating. The 1 new case, and we issued a number of public health alerts last night related to this case, was a gentleman in his 30s from Western Sydney, and it's under investigation. He has no direct links to the Baralla BWS or the Baralla cluster, and so we are being very cautious about finding any of those missing chains of transmission. So we are continuing to call for anyone who went to either the BWS or Woolworths in Baralla between December 20th or December 31st to check our website for testing advice. And depending on the time you were there, you may be a close contact who needs to get tested immediately and isolate for 14 days. So if you've not checked, please do so. We have also added a number of venues in Western Sydney connected with the case that I've just spoke about. So anyone who was at the following venues on the dates and during the times listed is urged to immediately get tested and self-isolate until you receive further advice from New South Wales Health. And now I just want to explain that initially what we're doing is doing stop and stay. So while we assess the risk in the venue, we get the lists, we contact people, alert the community, ask them to get tested and to remain in isolation. We will then get back, and as we have more detailed information about the layout of the venue, the way in which the person moved around the venue and the activities they undertook at the venue, that will inform whether people are close contacts and having to isolate for those 14 days or whether they're considered casual contacts. So please bear with us. That is the purpose of that initial stop and stay, and then we'll get back to you with the details. So the Sydney Murugan Temple at Mary's Hill on the Friday the 1st of January from 12:40 p.m. to 1:30 p.m. Maryland's RSL on Monday the 28th of December from 4 p.m. to 4:45 p.m. The Savannah Bhavan Indian Restaurant at Parramatta on Monday the 28th of December from 10:20 to 10:50 a.m. A cricket match at the Ollie Webb Cricket Ground at Parramatta on Monday the 28th of December. It was a social cricket match from 7:30 a.m. to 11 a.m. And Sydney Marina dine-in and takeaway at Pendle Hill on Sunday the 3rd of January, 12:30 p.m. to 12:50 p.m. We have also upgraded our advice for 2 of our Western New South Wales venues, and can I thank the community in Western New South Wales for coming out to test so strongly this morning. So if you were at the Birdies Noshery and drinking establishment in Orange between 12 p.m. and 2 p.m. on Sunday the 3rd of January, you are a close contact and must get tested and isolate for 14 days regardless of the results. If you were at the Gourmet Cribton at Broken Hill between 10 a.m. and 10:40 a.m. on Saturday the 2nd of January, not the 12 p.m. to 2 p.m. as reported last night, you are a close contact and must get tested and isolate for 14 days regardless of the result. And just a reminder to Sydney-siders that Broken Hill is on the Central Time, not Eastern Time. So if you're passing through and hadn't reset your watches, you may have been there half an hour earlier than you thought. Thank you.
Thank you, Dr. Chant. Can I start by just stressing again the need for everybody to get tested if you have any symptoms whatsoever, or if health has asked you because of a place that you visited that you need to get tested, please get tested. Every resident in New South Wales has a potential weapon to defeat this enemy, this virus, and that is by getting tested. Please do it. Please do it. Obviously, the SCG and the test is one of the great moments in the calendar of New South Wales. This year, of course, we've talked about the fact that it has to be done a little differently. And I want to stress that the announcement today off the back of the Victorian Minister indicating that there was a new case that they don't yet know the source of at the MCG is obviously influencing our thinking and Dr. Chant and her public health team's thinking about what we should be doing to keep New South Wales safe but still enjoy the opportunity of seeing the test. Yesterday I made some announcements about some suburbs where people, if they work or they live, absolutely should not attend the SCG, the Sydney test. We're going to add two more suburbs to that. So I'll just, for clarity, read those out yet again. Auburn, if you are a resident, or if you've worked, or you've been in Auburn, Birrong, Baralla, Lidcombe, Potts Hill, Regents Park, Rookwood, and Wentworthville and Belmore, you are not entitled, unfortunately on this occasion, to see or to at least visit the SCG to see the test. Please stay home and watch the test on TV. So we've added Wentworthville and Belmore on the basis of public health advice. And again, that's crucial that people from those areas do not attend. If you do attend, if somebody else has bought you a ticket, you may well be stopped by the very large police presence that will be there. And if you can't prove that you're living outside those areas, then you will be exposed to a $1,000 fine. So please don't do it. Just be with us on this journey. I know it's difficult because if you love cricket, you really love cricket. But on this occasion, we can't afford to love it and also end up with COVID. Don't go. Don't spread it. I also want to point out that the Victorian Minister, Martin Foley, and I have been communicating this morning, and obviously the Victorian government is concerned, and therefore the New South Wales government is also concerned about people who may have attended the Melbourne Cricket Ground on the 27th of December and was seated in the Great Southern Stand, Zone 5, between 12:30 p.m. and 3:30 p.m. The message to anybody who may be going to or intending to attend the test here in Sydney who was in that location on that day, you must not come to the test. Again, the orders that will be made today, the health orders, will impose $1,000 fines on any person who was in that location and who seeks to come to the SCG. Now, I know it's a tough ask, but it's absolutely necessary to keep New South Wales residents safe. You may think that you won't get caught. I can assure you that there has been plenty of evidence already of citizens, residents who are willing to speak up and tell us when someone's doing the wrong thing. So please don't do it. Don't do it for yourself. Don't do it for your community. Do it for the whole of New South Wales and the whole of Australia, if that's what you're thinking. But just don't go. The other thing is that if you're in an Uber, if you are in a taxi, if you are in a bus, if you're in a queue, if you're in the SCG, or at all times, you must wear a mask. That's the starting point. You must wear a mask. Again, there will be fines imposed on those who don't wear a mask in those circumstances. From the moment, effectively, you get into the transport to get there and get into the queue at the front door of the SCG and go to your seat and sit in your seat, you must wear a mask. Now, the only exception to that will be if you're eating or drinking. Obviously, Dr. Chant and the public health team want people to enjoy a day at the cricket, but it's a COVID day at the cricket. And that means mask on, not mask off, unless you're actually eating or drinking, in which case you can have your mask off. I'm going to now hand over to Howard Collins from Transport to give us some more information on those aspects.
Thank you very much, Minister. Good morning, everyone. So I'm going to talk about two things, the transport plan for the SCG Test Cricket and also generally comment about mask wearing. So the plan for the Test Cricket is we are running our plan, which would have catered for 23,000 arrivals, are now 10,000. We've got extra parking. We advise people, although it hurts me to say this, if you can drive with a designated driver, it is important that you use that method, maybe rideshare, Uber or equivalent, another way of getting to the test. There will be extra road measures in place, extra support to get you in and out of that area. But if you're using public transport, please ensure that, firstly, you don't travel from any of those stations within those areas, any residents from those areas that the Minister talked about, but also reminding everybody, mask wearing, sanitising when you start, keeping a distance, looking out for those green spots, and as we always say, if you're feeling unwell, do not travel, stay at home and get tested. Very important. Our plan involves road management, it involves 450 extra services on bus and light rail. The other thing I want to ask people to do, if you have an Opal card, please get registered. This is a very useful way of us tracing you if anything happens during your travel every day. So if you've got an unregistered Opal card, please register it as well. Almost like the QR code, it's a very good way of us working with health on tracing and tracking. Now I'm going to talk about general travel on public transport. I want to thank every single mask-wearing member of public transport for your cooperation. It has been overwhelmingly positive. But those few people who have somehow been on a different planet are not understanding mask wearing is mandatory. We are working with the Police Transport Command on a tasking operation. We have 10,000 CCTV cameras. We are observing those areas and working on a tasking operation which will provide support. My staff, who've done a valiant job in transport, are not going to police masking. That is for officials of the New South Wales Police to deal with. And we have already cases where fines have been applied on railway stations, and we have seen, obviously, generally overwhelming support. So I thank everyone for doing that. It is so important on public transport to wear a mask. And as the Minister says, when you're out and about, the best thing you can do at all of those locations, including travelling to and from the test, is make sure you wear a mask. The other piece of advice is say travel early, give yourself plenty of time. Don't all arrive in a rush at 11 o'clock or 10:30 on the first or second day. Please spread the load so we can queue you successfully. And when you're waiting, keep your distance between other groups. Make sure you maintain that 1.5 metre distance wherever you are. And I'd ask you, please respect our staff. They're doing an amazing job under very difficult circumstances, and the great cooperation we've had with the SCG says we have a good plan in place to get you to the ground and get you home safely every day of the test match. Thank you very much.
About masks at the SCG. So you need to wear a mask sitting in your seat at the SCG or face on
I'm sorry, James.
Wear a mask in your seat at the SCG unless you're eating. Is that right?
Or drinking, yes, that's correct.
But that's a change, isn't it?
Yeah, it is a change. Needless to say that we were trying to not impose that requirement because obviously people are sitting there in some cases for many, many hours, although obviously get up and go for a drink and go and get food and other things. But we were trying not to do that, but the evidence that's come off this morning from the Victorian situation is such that the public health officials were of the view that we need to step it up to that higher level. Look, it is about keeping people safe, and literally I think I've had 3 or 4 communications already this morning with the Victorian Minister. They're good enough to be constantly liaising with us on issues that arise, and so that gave us time to think about those issues this morning and to work it through with the public health officials. And we are very much of the view now that masks are an essential element of the armoury of keeping people safe. Sorry. Come. Ashley first. Yeah.
There's clearly risk. Why not just
Why not what, sorry?
call the cricket test off to grounds?
Look, New South Wales has struck, I think, the leading balance in the country in terms of keeping open what is normalcy, but in a COVID environment. That's always been our approach. And I think it's crucial that we remember the advice from Dr. Chant that she has given us regularly, and that is that COVID could well be with us for a long, long while. So from our state's point of view and the New South Wales government's point of view, we have struck the balance. We continue to strike the balance. And to simply say to put off the test or to can the test here in New South Wales just wouldn't be productive. You have to think about people's mental health, the desire for get out there and have some aspects of a normal life, recreational aspects, sport. They all give us a sense of well-being. And you know, particularly as Minister, Health Minister, I see some of the negative aspects of that very closely. Reports come to my desk on the very sad outcomes when people's mental health suffers. So we will strike the balance. We'll strike the balance. Sorry, can you just want to ask me one more question, I think, and then I'll go to the Deputy Premier. Sorry.
On the issue of crowds, given you've increased the number of suburbs that can't go to the SCG, why then can those people still go to sporting events in other regions, including soccer games that are coming up in Newcastle?
Yeah, look, Public Health has been working with Venues New South Wales on those issues to do with, for example, the A-League. I think I was asked about that yesterday by Chris. And the view has remained that the steps they've taken are working. Obviously, cricket presents a little different issue, and that is it's literally 5 days. In some cases, the real enthusiasts will be there for 5 days and possibly for 10 to 12 hours. So whereas into a footy match and out again, you're probably there for a couple of hours. It's markedly different. So, but again, it's balancing the risk with the outcome. Thank you. Sorry. The one thing I've learned as a health minister is never say never, because this morning, if you'd said to me at 7 o'clock there was going to be a case at the MCG which would impact our thinking, I'd have probably said that's possible but unlikely, but it happens. So I'll never say never. And I'll come to you next, but you, James.
Anyone who is visited
Our residents are obviously the primary focus, but if you have been working, that's why there's not a lot of residents in Rookwood, as you might be aware, thankfully. But there are a lot of workers and a lot of people who go in now there. So those people, we're asking them to not go as well. Sorry, yes. I'll ask Dr. Chant to expand on that in a minute, if you don't mind. Now, somebody want to ask the Deputy Premier? Or Ashley, last one.
Just in terms of morale in that area and getting the message out, are you confident that you're getting the message to all the community, especially those who don't speak English?
What I am confident of is that we're doing our very best. Public Health is working with Multicultural New South Wales, and you've got to remember that we've been doing this now for nearly a year. So Public Health's very good at it, and they're reaching out through a number of different avenues in multiple languages. And we've also called yesterday, I don't think you were here yesterday, but yesterday we called for community leaders. We know that there's 8 primary larger communities there, multicultural communities. We called for the community leaders to actually make sure that their communities were hearing messages through them as well, because we know they listen to them. And I've been working extensively with the local Labor member, but that's, we work together, and we're quite confident that the messaging is getting out as best as it can, but we'll keep doing whatever we can do on that regard. I'm going to ask Chris. I'm sorry, Chris.
It seems there was another one as recently as yesterday morning. What would you say about that?
I missed what you started off with. Oh, yeah. Again, let me make this very clear, very, very clear, and that is COVID tests must be free. There are no circumstances, well, there's one circumstance, that is a particular government requires people to have a blood test to travel to that particular country. But for the rest of us, for all of us, for the entire New South Wales non-traveller community, if you need to have a test because we've asked you to have a test, you've been exposed to one of the venues we've highlighted, or because you have symptoms, the test is free. I'm sorry, hang on, let me finish, please. Let me just finish. So, if you go into, because we had to work with both the private sector and New South Wales government pathology, we know that there has been some confusion amongst at least one pathology private service. I spoke to the local member out there at Auburn this morning, and she actually gave me evidence of the fact that there had been at least one test where somebody had been charged. My response to that was to get straight on the phone to the Deputy Secretary of Health, who got straight on the phone to the Chief Executive and have made it very, very clear in unequivocal terms, people will not be charged. If you have a Medicare card and you're asked for that, well, all right, you can submit that and they can recover some money from the usual Medicare arrangements. But if not, you get it absolutely free from New South Wales. New South Wales government is backing that in completely, and has been, by the way, going back, it would have been at least 10 months ago when we realised we had citizens here who were effectively locked in from other countries. And I remember issuing an instruction at the time that if you needed health services, even in our hospital, major matters that could cost many thousands of dollars, it's free. So don't ever hesitate to get your services that you need through our health system, our state health system, but also know that when you go to have a test, if you're a resident of New South Wales or a visitor, just tell them it's free. Sorry, you guys.
Surely there's quite a few clinics that require you to pay to go to see a doctor first and get a referral and then go on to the testing clinic.
No, that would only be if you went. That would only be if you went to a GP first. But we run clinics right across there. In that western area, there's
testing sites that require a referral first.
I will ask Dr. Chant, but I think you'll find that that's only in very limited circumstances. But all of the clinics, there's more than 26 testing clinics in that area. We opened a new one yesterday at Barilaro Public School, and they are free, and they should be free. Simple.
Fines that have been handed out for people not wearing masks.
Yeah.
There was one person who was fined. He said he was in a hurry and forgot to bring it with him. Would it not be in that situation saying more prudent for an officer to hand a person a mask and then if they don't put it on, fine them?
Look, there have been a lot of efforts to hand out masks in various locations where that's been an issue. And certainly I know that the discretion that has been encouraged with police is to not hand out masks where there is obviously someone's just slipped their memory. So hopefully that won't be, but I'm sure that if that person is in that position, make an application to the Commission. The Commissioner will review all those matters.
Does New South Wales do genomic testing on all returning travellers who test positive, particularly those from the UK?
Dr. Chant, who's the expert on this, answer that question. Dr. Chant.
So, look, I might answer the question from before, which is why the new suburbs were linked. One of the new cases lives in Wentworthville. We didn't know where the person acquired it from, so for the abundance of caution, those unlinked cases causes the greatest concern because we are concerned about unrecognised chains. That's why Wentworthville has been added, and it also abuts onto that broader area around Baralla, Greystone sort of area. Also, the other case was Belmore. That was one of our recent unlinked cases that we actually know are linked to genomically to Baralla. That person did actually work through a broad geographical area, but again, because we haven't actually pinned down the source, we've taken a very precautionary approach. The question around genomic sequencing is yes, we do genomic sequencing on all our viral strains, and again, can I just acknowledge the work of the laboratory based at Westmead, headed up by Vitali, who staff have been working almost literally day and night over the Christmas period to sequence it. Obviously, we are asking them to prioritise critical specimens that were there for public health purposes. So where we have a decision point knowing it is one source as opposed to another, but then they routinely go through and do the overseas acquired strains. That was why I was able to indicate that when we were looking for the source of the Avalon cluster, we'd obviously gone back to our reference bank of all of the overseas strains that had been sequenced and to figure out which was the closest link and could there be any as a one line of the investigation.
I mean, would it be time to rethink testing UK or Australians in the UK who are coming back to Australia to try and cut out that potential transmission line?
I think we know that the viruses are going to be moving around. The UK strain will potentially be everywhere. So I think we do have to have a universal approach to ensuring that we keep our citizens safe, and we take a sort of universal precautions approach to making sure our infection control, prevention and control is just at the highest bar we can do. I think adding testing or prior to departure screening, I think is useful in some circumstances. I think, though, we should really just emphasise that, I remember I've said it multiple times, that a single test does not determine it. So if you've been tested 24, 48 hours before you travel, you still could be infectious on the plane. And so again, no single action can make it totally safe, and that's why we have the quarantine protection for the full 14 days, irrespective of what people might have tested or might have done preceding. We do know that in-flight transmission is a risk, and we do know also that we are concerned that when people have been transiting through various hubs. So again, any returning travellers to Australia, we would urge you to be particularly cautious in even your flight home. Make sure you're maintaining those good quality controls. They can add pre-flight testing as another adjunct, but you need a sort of multiple barrier approach, and ultimately it's about effective quarantine at the end.
In-flight transmission is a risk, and given that there is increasing prevalence of COVID-19 overseas, why is New South Wales Health still not testing all international airline crew when they arrive in New South Wales, and wouldn't testing international crew give you a bigger data set in terms of genomic sequencing that you can pinpoint possible future?
So I think there are many actions which we are concurrently approaching, and at the moment we've got to look at where our greatest risk of incursions and how to prevent those incursions where it might spread to the community. So we announced that flight crew are required now to basically be in hotel quarantine with limited exemptions for staff that may be resident in New South Wales. We've also ensured that flight crew cannot reposition or travel on any domestic legs of their travel, and that the companies have to reposition staff on empty aircraft, again to put those barriers in place. Clearly, we are also enhancing our testing regime around our quarantine facilities and ensuring that we've added salivary testing of security guards and then progressively other workers. We've been testing around our health hotel in terms of this surveillance testing for quite a while. That's been our focus. We will then, clearly anyone who is self-isolating, who is flight crew, get a test at our airport. And we will also progressively look at testing the airlines. I've reached out to Qantas, and Qantas have indicated that they're going to regularly test their flight crew staff. And we also have had advice from the airlines in regards to their testing frequency. A number of the airlines and the Commonwealth has helped us collate that data, and we'll be engaging with those airlines about flight crew testing. But as I said, it is important that we focus on the key risks. I can only ask so much of our staff at this point in time, but it's certainly somewhere we get to. The experience in the other jurisdictions has been that by the time the test result comes back, the flight crew, who are usually on very tight 24-hour turnarounds, have actually departed, but it does give us intelligence if we're looking at any breaches that subsequently happens in the community. It gives us a point in time where that might inform how the transmission occurred.
But you don't have now, because international airlines, they don't need to have their staff tested when they come into New South Wales, do they?
So just to be clear, the process that's in place is that all flight crew are required to quarantine. The purpose of flight crew testing is more in terms of giving you a time point for genomic sequencing, which might inform if you've already had the escape. Our priority at the moment is making sure that we have an even earlier warning system, which is making sure we test thoroughly around our flight crew hotels, our hotel quarantine, to pick up that incursion at the earliest possible time. And we will be working to institute the flight crew flu testing, but our priority for our lab capacity at the moment is that surveillance testing in those quarantine hotels.
Can I just ask one more? Are PTS workers subject to daily surveillance testing? They get daily
So transport workers are also getting picked up in our surveillance plans as we scale it up. I'll just confirm, but I understand that they have, a number of them have been tested, so I'll just double check. I think we realise that you need multi-layers of defence, and we're adding surveillance testing. And surveillance testing in our quarantine facilities quarantine hotel, has been underway for a long time, and for many weeks we've been scaling the testing in other settings. And I'd just again like to acknowledge the work of the laboratories in developing a salivary test, which makes that daily screening much more acceptable and a very sensitive test. Yes.
Testing in Barella, are you happy with the amount of people who are coming up specifically from that area among the 32,000 that are actually from Western Sydney, those areas are concerned?
So I reviewed the testing rates today, and I've got to say thank you to the community. The rates are actually quite good, but as a public health official, I'm not readily pleased with those levels. They're not at the levels of the northern zone of the northern beaches, but I suspect that will be a very high bar to set. But the community has responded. But this is a time where every day counts. And so my message to you would be, if you think you've got a bit of a runny nose but think it'll resolve tomorrow, if you've got a bit of a sore throat, a bit of a headache, don't put it off, because knowing that you have COVID will help us block any chains of transmission. And the higher the testing rates, the greatest confidence I can stand before you and say we're not missing much transmission. And that's the magic question here at the moment.
Thank you. The National Cabinet agreed definition of a metropolitan hotspot is a 3-day rolling average of at least 10. As of yesterday, it's been 4 in Sydney, and we haven't met that definition of a hotspot for Greater Sydney for several days. Why are the borders closed?
Well, I might refer to Dr. Kerry Chant in a minute, remembering the borders are closed not because of New South Wales, but because of those other states.
But what's the point of National Cabinet?
Well, that is a question for the premiers of the other states, who are the members of the National Cabinet. And look, I had a phone call from Scott Morrison only a couple of days ago offering support, advice, and I thank the Prime Minister for that. He wanted to stay up to date with the information that we get, and I'm privy to through the health advice that I get from Dr. Kerry Chant and her team. But the reality, those are the questions that you have got to ask those other premiers and those other states. New South Wales has always led in this space, have kept borders open as long as possible. And if you go back to when the Victorians had their outbreak, you know, we didn't close that Victorian border until the cases got to about 140 to 180 a day, consecutive days, where unfortunately these states, now this isn't a state of origin. States will make these decisions. It is about the public health. We've endured what was a turbulent 2020. We've learnt a lot along that journey. And what will happen in 2021, in my view, is that we will always respond in a way that we said, by not, in a way, if we want to keep restrictions limited and we want to get on with a balanced approach with the economy and jobs, what we've got to be able to do is respond fast, hard and local. It's what we did on the Northern Beaches. It's why the success of the Northern Beaches is what it is. And I know there's still pain for those in the northern zone of the Northern Beaches, but we're almost there, and I thank you for your patience. I'm not going to lecture other states, and we don't want to be lectured either. Those states will make their decisions. I'm confident in the National Cabinet process, which has been successful. I think in the period of 10 to 12 months, what we have seen there during the height of the pandemic, the National Cabinet, I believe, led by the Prime Minister of this country, achieved what it was set up to achieve. We're at the tail end now, and what happens is states are making their own decisions. And the best I can do is implore them to work with all of us. As you heard this morning, Minister Hazzard was on the phone this morning with his counterpart in Victoria. I know yesterday I was privy to a phone call that I saw that he was with his counterpart in Queensland. What we're doing as a state, knowing that we're the #1 state, the engine room of our economy, is we'll continue to talk and work with other states.
When will the Northern Beaches economic...
National Cabinet considering a ban on UK visitors given the mutations we've seen now?
I don't speculate. I'm in the hot seat for a small period of time. The boss will be back later this weekend, and I'm confident whatever needs to happen and be debated, and the conversations at National Cabinet, well, that's above my pay level.
When will the Northern Beaches economic assistance to businesses up there in the far north, as promised by the Premier, when will that start to flow? Those guys are in lockdown now till to the 9th, guaranteed. When are they getting the help?
When we locked down the Victorian border, the impact that had on Albury and that region, the impact. Yeah. Well, I can tell you that this morning in our crisis cabinet meeting, the Treasurer, Dominic Perrottet, informed the leadership team that he's working with Minister Tudor, I hope the Minister for Small Business, and he's also been in conversations with the Treasurer, the Federal Treasurer, Mr Frydenberg, and we will respond in due course. And I'll leave that to the... Well, look, again... Well, again, you know, the support will be there in some shape, way or form, and I'll leave that up to the Treasurer to announce when it's appropriate. Well, it's not so difficult. What we do is tomorrow things could change. Tomorrow things could change where the impact could be even more severe. And therefore what we will do is work with that community, and I know Rob Stokes, I know James Griffin, I know the federal members have all met with their Chamber of Commerce in that region. They're working with the Federal Treasurer, the State Treasurer, the Small Business Minister.
A lot of meetings, but
absolutely, but we are trying to find that solution. I'll leave that up to the Treasurer.
Last question. Is the vaccine rollout timeline too slow?
Chant probably can answer this better than I can, but the reality here is the TGA, who's always overseen vaccines or anything to do with medicine in this nation, has an appropriate process that looks to the data. We already know there's some anxiety in the community that these decisions are maybe rushed. What we don't want to see is a rushed decision where actually the community take-up may be you know, on the low end. And the truth is, and I saw some news this morning, it might be even a couple of weeks earlier than first intended. I'm confident, I'm supportive of where the federal government is in this place. There is no politics to be played about the vaccine. Let's do it in a timely manner. The experts know what they are doing, and governments will take that advice. And remembering, this has all got to do with the federal government. Well, I'm not going to get into a public debate with the Premier of Western Australia. It's, of course, similar to Queensland, timely around an election, the state election. That whole state of origin seems to work well for those premiers that are in election. My comments was about being lectured. We were being lectured by Western Australia that somehow the approach and the framework that we have in place in this state one that I absolutely believe is gold standard, and I think Minister Hazzard once called it diamond standard, is one that actually protects the people of New South Wales. What I don't like is being lectured by other premiers. We're not going to lecture them about what happens in their states. We want to work together. To be called un-Australian and unhelpful in relation to what's happening in WA, remembering we are one nation. WA's closed the borders on New South Wales, but it wasn't our turn. Thank you.